Have you ever had a blood test come back showing high vitamin B12 and wondered what it actually means? Let's break it down. Most people worry about not getting enough B12, but what happens when your levels are high? The answer is a little more nuanced than you might expect. Here's the key thing to understand. High vitamin B12 in your blood rarely causes symptoms on its own. Unlike B12 deficiency, which can lead to recognizable neurological and blood-related problems, elevated B12 doesn't typically produce a distinct set of symptoms. In fact, most people with raised B12 levels feel completely fine and only find out through a routine blood test. So if high B12 isn't usually causing harm directly, why does it matter? Because it can act as a biochemical marker, a signal that something else in the body may need attention. Elevated B12 is often linked to underlying conditions such as liver disease, certain blood disorders, or chronic kidney disease. In those cases, the B12 isn't the problem itself, it's rising as a secondary effect of something else going on. It's also worth knowing that occasionally a laboratory artifact can make B12 appear falsely high. Your doctor may repeat or confirm the test if they feel that's needed. If you are experiencing symptoms alongside a high B12 result, it's worth paying attention to what those symptoms are. Things like jaundice, unexplained weight loss, unusual bruising, night sweats, abdominal swelling, or changes in urine output aren't caused by the B12 level itself, but they may point to an underlying condition that needs investigating. For people who take B12 supplements, particularly injections, there are some recognized reactions to be aware of. Things like injection site reactions, rash, or itching. In very rare cases, a serious hypersensitivity reaction can occur. If after a B12 injection you notice swelling of the face, difficulty breathing, or a severe skin reaction, call 999 or go to A&E immediately. B12 is a water-soluble vitamin with no established upper safe limit, and any excess is naturally excreted by the kidneys. So management isn't about trying to lower the vitamin level directly, it's about identifying and addressing any underlying cause. What should you actually do if your B12 comes back high? The most important step is to speak to your GP. They may want to look at the full picture, including your liver function, kidney function, and blood count, to understand why the level is raised. If you're taking B12 supplements, let your doctor know, as supplementation is one of the more straightforward explanations for elevated levels. And importantly, if you've been prescribed B12 for a diagnosed deficiency or a condition like pernicious anemia, don't stop taking it without speaking to your GP first. That's a very different situation from incidentally raised levels. Don't try to interpret the result in isolation. A single number on a blood test rarely tells the whole story, and your doctor is best placed to decide whether further investigation is needed. To recap, high vitamin B12 is usually found incidentally and rarely causes symptoms by itself. When symptoms are present, they typically point to an underlying condition rather than the elevated vitamin. Management focuses on investigating and treating the root cause, not simply lowering the B12 number. This video is for general information only. Please speak to your GP or pharmacist for advice that's right for your individual situation. For urgent concerns, contact NHS 111, and for emergencies, always call 999 or go to A&E. If you found this helpful, leave a comment below. We'd love to hear your questions. And for more straightforward health information like this, give us a like and subscribe to the Bolt Pharmacy channel.